years ago was at or below poverty level. During recent economic times, that is going to rise. That will place a burden on our already overburdened volunteer system. So we have to continue to reach out to our neighbors. We have to continue to promote volunteerism because this is where it's at. We need to help each other. Through the Office of Emergency Services, we look at farther reaching volunteerism. I just came back from Oleana on Friday, and we reached out to Cattaraugus County and Allegheny County to extend a Citizen Corps initiative of 3 counties comprised together. And this council will help to take people that are retired, people that have an interest in volunteering, but maybe can't be a firefighter, maybe can't be an EMT, but want to assist in some way. And for those that can be firefighters and EMTs, through the Citizen Corps Council, we maybe can get them assigned to a fire department. Again, it's a way to reach out, expand our access to volunteers should we have a large event. The offices, John mentioned the EOC, or the Emergency Operations Center. Should we be faced with a crisis like Erie County found themselves in the big snowstorm, that is the center where, again, we would all come together. And we've worked very hard to put many plans in place. So we're very fortunate to have had some foresight and had some movers and shakers to help us prepare in our own small community. We don't feel that we're probably at a risk for a 9/11 here, but yet in light of what happened in Binghamton, and then just shortly before that, a small community, an individual came in to a nursing home facility. Those kinds of things can happen. But I know that there's people in this room that will rise to that challenge, and they will meet it head on and deal with it to the best of their ability. And I'm very proud to be here tonight, to be one of you, and to be having the ability to work to provide resources that you can tap into should we ever have to face a greater crisis other than just a fire or basic EMT calls. On the tables, there is a card, and it has a question on that card. And what I'd really like for you to do, if you have a chance, if you can at all, try to assist me with this project, is that our health department has to do a community health assessment every 4 years. Now, often they don't get out to the emergency responders or fire folk, so this is a very great opportunity for your voice to be heard. You can do them individually, or you can assign someone at the table to just write your ideas down. Just what comes across first? What is the greatest health need in our community? Is it transportation? Do we haul? Do we use our EMS system to transport individuals to the hospital? Not because they're really critically ill or they're in an emergency, but they really just don't have any other way to get to the hospital. Prenatal care, diabetes, stroke awareness, access to dental care, access to home care for the elderly, anything. Write it down, and these are all going to go back to the health department, and then they're going to identify what are the top 10 needs that come across consistently, and that will help levy funding, go to state, work with legislation to make a change so that our community access to care can be much better. So tonight, all of you have an opportunity for your voice to be heard and again make a difference for your neighbors. I just want to thank everyone that had their hand in putting this together. This is an awesome event, and it's nice to be in a room and just have a cooked meal that I didn't cremate for my husband. I'm sure he's very appreciative. The smoke detector won't need a new battery tonight, so with that, I'll just again say thanks and have a great evening.
Thank you, Norma and John. And if you do get a chance to fill out that little card, there should be some on each table. It would be wonderful if you could fill it out, give your suggestions. Excuse me. Our next speaker is going to be Deb Weaver from Starflight. She's going to give us a kind of lowdown on what's going on.
Good evening. First, I want to thank everybody that was instrumental in getting this group together. And I have to agree with John. I think this is one of the nicest things anyone's ever done for EMS. I just really am impressed. You guys are lucky to live at this end of the lake. They appreciate you up here. I also have to agree with what John and Norman were saying. I represent a resource that our county has that transcend the geography and the political arena that sometimes we get caught up in. And I don't know if you guys know that Starflight is one of the first programs in the United States that was a collaborative effort between a municipal agency, which is the Sheriff's Department, and the WCA healthcare system. And I listened to you guys talk about finances and how much money Western New York doesn't have. And I don't know if you know that when the helicopter's sitting at the hangar, it's not costing anyone a whole crew. Only the pilot is there. He's a sheriff's employee. Everyone else is on somebody else's payroll. The nurse is at the emergency room, the medic is in the ambulance, and the co-pilot is doing whatever the co-pilot's other job is. He's not being paid by Starflight. Only when an actual call comes in does that helicopter start to actually generate some costs involved. And that's kind of an unusual program. It's an unusual setup. Most helicopters on days like today are sitting with a full crew at a hangar just running up the bill. And that was a very innovative idea that was put together by Mr. Marsh and Mr. Bentley years ago. What I'm actually here to announce is that we, Chautauqua County residents, are the proud owners of a pair of McDonnell Douglas 900 Explorers, MD 900 Explorers. We took delivery of them in late December. Some of you might have seen them. I know one made the front of the Post-Journal and one made the front of the Dunkirk Evening Observer before the sheriff was able to introduce them formally. They were the first one was actually put into service March 5th. It's flown about 35 flights this month. It's still rotating in and out with the big old Huey. It's not, we don't have both new ones in service yet, so we're still using both. What I'd like to point out is when I was in Washington last month at a safety hearing before the Congress, I went to the Smithsonian to see the War Museum, and the Huey that is on display at the Smithsonian to represent the Vietnam era was built 4 years after the Huey I flew in Wednesday night. So it was a little weird. But I will note that the Huey at the Smithsonian flew to Washington and was dollied into the museum, and I dare say, if we needed it, could be wheeled out and would fly away. The Hueys are wonderful aircraft. However, they now reside in the Smithsonian, so it's kind of time to retire ours. The new MDs, they're sometimes called Mad Dogs because of their initials, are dual system, everything. We still will have our 2 pilots. We will have dual controls. We will have 2 engines. The helicopters are made in the United States. They have Pratt & Whitney engines that are made in Canada. They are quieter. They are faster. They are more economical. It costs about half of what it costs to operate the Huey. Still have the nurse and the medic in the back. And this is going to enhance our ability to service our community. What John said, just because we live in Western New York doesn't mean we don't deserve some of state-of-the-art. And this will actually assure the viability of our program for years to come. These helicopters will definitely outlast my career and hopefully many of yours. I do want to tell you that we're in-servicing the entire fire service for the county. So if you haven't been notified of a ground school, there will be one coming to a fire department near you very soon. And just to know, you think about what Norma said about the number of people in our county that are ill chronically and ill acutely. In 40 hours this week, earlier this week, we flew 10 flights in 40 hours. We've flown over 5,000 patients in our 22-year career, and the numbers are climbing rapidly. And that's all I have to say. Thank you again to everybody that organized this.